Hello everyone, I am Dr. Remya. I am working as a rehabilitation specialist in Rajeri Hospital. So here in this video, we would like to share some hints regarding the general tracheostomy care. Tracheostomy tube, we all know it's a tube which is helping in ease of respiration, helping in suctioning process. So the number of patients who are dependent with tracheostomy, the number is increasing these days. Due to the brain injury in the brain injury rehabilitation and in the post-COVID sequelae also, the tracheostomy dependence is there sometimes. So the number of patients who is dependent on tracheostomy are increased these days, and someone has to be taken care at home, or the nursing care should happen properly at hospital side. So in this video, we would like to share you with some hints regarding the general tracheostomy care, how a safe suctioning procedure can be done, how the safe deflation inflation is done. So general tracheostomy care is shown in this video. Kindly go through this. If you are having any doubts, please mention it in the comment section.
So this is the routine tracheostomy care set. Make sure all the needed things are there inside. Cut goes, sterile goes, and the needed trays. Now the staff wearing all the personal protective equipments, adjusting the pressure. So ideally it should be between 80 to 120. So keep that pressure. Carefully remove the inner cannula, stabilizing it with other two fingers, putting it in saline, because dried secretions may be there. This is hyperventilating. So this is in a rhythm of press 1, 2, 3, 4, 5, press like that 3 repetitions. This is for hyperventilating. Then instilling the saline, about 2 ml is instilled at a time. Again ventilate 1 to 2 times with ambu. Carefully take out the ambu bag. Measure how much of the suction catheter should be inserted, that is the length of the inner cannula. Then watch for when she is applying the suction pressure, that is at the time of withdrawal only. At the time of withdrawal only. Then cleaning the inner cannula with sterile gauze. Dried gauze is used for this. Roller gauze is used for this. If brush is available, we can use that. Otherwise, clean the inner cannula like this. Again, reinsert carefully in this fashion by stabilizing the tracheostomy with other two fingers. Now, we are clearing the secretions through the suction aid. This has to be done each time before deflation, or if the doctor is asked for corking, then also we have to remove the secretions like this. This is done before deflation. Here she is deflating. If any liquid is coming out, just expel it. Now, if doctors are asked for corking, this is the routine sterile cork that we use. This makes the opening perfectly fit. There will not be any air leak. Secure it with micropore. This is done before decannulation, for the trial of decannulation. Now she is removing the tracheostomy corking and inflating the tube. Make sure regarding the cuff pressure. Ensure it in 5 to 7 cc. Ideally it should be checked with pressure manometer. Now she is about to give the routine care with wet saline gauze. Clean thoroughly the area. Inspect if there is any leftover sutures are there. Otherwise it is embedded and it will be difficult to remove it later. Watch for any skin redness or any ulceration. Keep the sterile cut gauze carefully at the lower part. One gauze will be enough to cover the trach tube area. Remove the twine carefully. Always take assistance help. It is a two-person procedure. One person has to secure the tube flanges with 2 fingers. Ensure that the cuff is inflated at this time. Tie up the twine carefully. The 2 ends should be like one end shorter and one end longer. The shorter end should be tied to the longer twine of other side, and it should be 1 finger tight. Now cover it with wet saline gauze. This is for humidification, and this makes the general tracheostomy care complete.